Welcome back to Health Today. Before the break, we witnessed a total ankle replacement surgery performed at Shore Memorial Hospital with pediatric surgeon Dr. Ira Fox, who is now here in the studio with us to discuss more, as well as Mr. William Johnson, who has received a total ankle replacement surgery himself. Welcome to the show, guys.
Thanks.
Thanks.
Dr. Fox, can you tell us about some of the indications for a patient like Mr. Johnson for ankle replacement surgery?
The primary indication is pain. Pain with activities of daily living, pain with activities of work, or pain with athletic activities.
Okay. Mr. Johnson, what made you choose to get the ankle replacement surgery?
I couldn't walk no more. Walk without pain, so
So you were having pain, like Dr.
Yes.
Fox said? Okay. Was it more from an injury or?
I have rheumatoid arthritis.
Okay. All right. Dr. Fox, can you show us some of the prosthetic items and tell us about the surgery?
Sure. The surgery is done in the hospital as an inpatient, usually 2 to 4 day stay. It requires general or spinal anesthesia, and with some patients, a stay in rehab facility is required after discharge from the hospital. There are several different types of ankle joint replacements on the market, but the one I'm using these days is from a company called Wright Medical. And what it has is this stem that goes into the bigger bone in the ankle joint, which is called the tibia. And then this bone goes into the foot, called the talus. And then there's this plastic piece in the middle that it acts as the cartilage. It goes back and forth.
Okay. Now, for somebody like Mr. Johnson, are there any patients who this would not be a good indication for them?
Sure. First of all, if you're extremely overweight, you can't have it done. There are some, you can be somewhat overweight, but extremely obese is a contraindication. Yeah. If you have diabetes, it's a relative contraindication. And if you have severe peripheral vascular disease, that's a contraindication as well.
Okay, so some patients maybe would choose another surgery.
Correct.
So what are their options?
Right. For late arthritis, for end-stage arthritis, you really only have 2 surgical options: an ankle fusion or the ankle joint replacement. Okay. Ankle fusion is where you take the 2 bones of the talus in the foot and the tibia in the ankle, and you flatten them out and put them together, and you keep them in place with a screw or with an external fixator.
Yeah. Can you show us on the?
Sure. And this is a model with the ankle joint replacement in it, and it moves like this. Mm-hmm. And in a fusion, what we do is we take off some of the bone from the tibia, which is this big bone, and some of the bone from the talus, which is this bone in the foot, and then the foot's rigid like this. The disadvantage to this is there's no motion. Mm-hmm. And that means, for example, a woman patient couldn't wear any kind of a heel. There's stiffness in the ankle joint, which makes the joints that are farther forward get hypermobile, and patients often will develop arthritis in those joints after some time. And I think Mr. Johnson here is developing that because he has an ankle fusion on the other side that he had about 2 years ago.
So, Mr. Johnson, you have one ankle that's fused, which is the surgery we used to do.
Correct.
For years. And since this new technology came around, now we're doing these joint replacements.
Correct.
So can you tell me about your fused ankle, how that's going, and the ankle replacement?
The right ankle is not doing good at all. There's constant pain, there's swelling.
That's the fusion?
Yes, that's the fusion.
And when was that done?
That was done roughly about 2 years ago.
2 years ago. And tell us about the ankle replacement.
Ankle replacement is really a pleasure because there's almost no swelling, and I can walk free on it.
We did this in January.
In January.
So he's about 5 months, almost 6 months post-op.
Okay. Now, Dr. Fox, when you do an ankle fusion, for people that have had an ankle fusion, can they later get an ankle replacement? I mean, do the fusions last forever? Do ankle replacements last forever?
All right. Fusions are supposed to last forever. Once it's done and it's solidly fused, usually you don't have to go back in. Ankle joint replacements may wear out. It depends how old you are when you get it and how long you live. They usually have about a 15 to 20 year life expectancy. So if you're going to live 30 or 40 years after you have it done, you may have to have parts of it replaced again. Ankle fusions can be taken down and converted to joint replacement. However, one of the things that happens after an ankle fusion is the calf muscles atrophy because you don't use them to bring your foot up and down. And then if you do an ankle replacement in a patient that's had an ankle fusion for a long period of time, they may not get the range of motion that you would hope to expect.
Okay, and then those patients might have to get a fusion. To get an ankle replacement that had the fusion because they have so much arthritis.
Correct.
Okay.
Correct.
All right. So, Mr. Johnson, can you tell us the ankle that feels good now compared to the fusion? Would you consider an ankle replacement?
Yes.
You would consider an ankle replacement.
100%.
Well, we'll be back in just a moment after this short break.